Elizabeth, I would have a hard time voting for this bill as well that we've seen that the Senate has.
Why is that?
Well, it's got a $50 billion bailout in it. It doesn't incentivize continuous coverage. And the absolute biggest thing that I hear from my constituents is that the premiums are too high, that the deductibles are way up there. So, in fact, so high that we can't. Most people can't even use their.
So you would agree with Senator Dean Heller there, where he said, "Listen, this isn't bringing down premiums."
Well, I do. I think this is now. Let me backtrack a little bit and say that this is a good bill in terms of rolling back what we have. Obamacare is an abject disaster. It's in a death spiral. People are losing their coverage right and left, or they're electing not to go into it. It doesn't do them any good. And so
or sometimes they only have one provider.
Only one provider. Many counties in this country now only have one provider, which is a bad thing for families, working class families in my district.
Okay, so we talk about these 5 holdouts. What type of leverage do they have, do you think, in the Senate? Because there needs to be some changes before you see the bill, am I right? Before it gets to the House and there's any chance of it getting through the House.
Right, and let me say this, Elizabeth, I'm optimistic. You know, the Democrats said we wouldn't get anything out of the House, and we did. They said the Senate's not going to have anything, and we're already talking about what they're proposing. We're still in an early stage. There's going to be a lot of exchange of ideas, and of course we don't have room to play with, as your last question was. We've got 52 votes plus the vice president in the event of a tie. So we can't lose, more than a couple of votes.
Right. Well, that being said, I mean, people were critical that it was drafted behind closed doors. So maybe you would have more votes if it wasn't. Do you agree or disagree?
Well, I'm not sure how accurate that is. You know, I think the public probably didn't see what they were talking about, but I think there was some input. There were some listening sessions as well. We had them in the House. I wish we'd have had more, but that's the way it goes. But I think that we have a very good opportunity. Let me tell you, anything that we wind up getting before us is going to be better than what we have today.
Are you worried about that CBO report on the Senate bill?
Well, I'm not really worried about the CBO. I mean, look what they predicted about Obamacare. It was totally inaccurate. When they say that 24 million or 25 million are going to be, or 23, whatever it was, the last CBO report in the House version, a lot of those are going to be people that just elect not to have the coverage because the mandate's not there anymore, and they'll save their money and roll the dice and take a chance, saying, hopefully I won't get sick.
Right.
But the lack of incentivization of continuous coverage in the Senate plan is something that's going to have to be remedied, because you cannot be sick or injured in an ambulance going to the hospital when you decide to start buying your insurance. That'll drive premiums up, and we'll have to stop that.
We don't have a ton of time, but I've 2 questions I kind of want to bridge into one. A, are you willing to work over the August recess? And B, are you willing to hear from the other side and try to get their vote, Democrats?
Absolutely. I'm willing to work over the recess, whatever it takes to get this thing passed, because we've been campaigning and promising to repeal and replace Obamacare for so long. Now, as far as the Democrats, I would absolutely welcome their input, but I think they're more interested in seeing the Republicans fail than to give the American people something better than what they've done for the last 7.5 years. And Obamacare, we were lied to. If you like your doctor or your policy, you can keep it. That didn't happen. And they keep talking about folks losing their insurance under the Republican plan. Well, millions have lost their insurance under under Obamacare, and so it's going down the tubes. Insurance companies are bailing out. As you said, there's not but one choice in many counties. So we have to get something passed. And I'm optimistic that we're going to put our heads together and get this thing and pass something that is going to be something that will give us freedom of choice and get these premiums down.
Well,
I'm optimistic.
I appreciate your optimism, Representative Babin, because we're looking at a big week, and we'll see what happens with the CBO report and what happens with the Senate, because there's some Republicans who are holding out. So we'll see. Thank you so much, sir.
You're welcome. Good to be with you.
Thank you.